How does levodopa compare to other Parkinson's medications? When it comes to treating Parkinson's disease, many people wonder how levodopa stacks up against other medications. Levodopa, often combined with carbidopa, is considered the gold standard for managing the motor symptoms of Parkinson's disease. This includes symptoms like tremors, slowness of movement, and rigidity. Levodopa works by replenishing dopamine levels in the brain, which are typically low in people with Parkinson's disease. Since its approval in 1970, levodopa has remained the primary treatment for most patients, being prescribed as the first-line therapy in about 70% of cases. Levodopa is highly effective at improving the main motor symptoms of Parkinson's disease. However, it does not significantly help with some non-motor symptoms, such as balance issues, speech difficulties, or swallowing problems. As the disease progresses, many patients find they need higher doses of levodopa to keep their symptoms under control. Other medications, like dopamine agonists or monoamine oxidase B inhibitors, may be used alongside levodopa or as alternatives, but they usually do not match levodopa's effectiveness in controlling motor symptoms. Levodopa comes in various formulations, including immediate release and extended release options. The immediate release form typically starts working within 30 minutes to 1 hour and has a short half-life of about 1.5 to 2 hours. This can lead to fluctuations in symptom control, often referred to as on and off times. Extended release formulations aim to provide a more stable supply of dopamine, but they still do not guarantee completely consistent dosing. This variability can lead to periods where symptoms worsen before the next dose takes effect. While levodopa is effective, it does come with side effects. Common side effects include involuntary movements, nausea, abdominal pain, dizziness, confusion, and changes in blood pressure. These side effects can become more pronounced with long-term use. Other Parkinson's medications have different side effect profiles. For example, dopamine agonists may cause sleepiness or impulse control issues, but they typically carry a lower risk of involuntary movements early in treatment. When comparing levodopa to other Parkinson's medications, dopamine agonists mimic the effects of dopamine but are generally less effective than levodopa for motor symptom control. They may be preferred for younger patients to delay the use of levodopa and reduce the risk of involuntary movements. Monoamine oxidase B inhibitors and catecholomethyltransferase inhibitors work by prolonging dopamine activity or preventing its breakdown. These are often used alongside levodopa to help smooth out symptom fluctuations. Anticholinergics and amantadine have more limited roles and are usually used for specific symptoms or in combination with other therapies. In summary, levodopa remains the cornerstone of treatment for Parkinson's disease due to its superior effectiveness in managing motor symptoms. Other medications serve as adjuncts or alternatives to address specific needs, delay the initiation of levodopa, or reduce side effects. The choice of medication is highly personalized, taking into account individual symptoms, disease state, and how well a patient tolerates different treatments. Always consult healthcare professionals for tailored treatment plans, as responses to medications can vary widely from person to person.